You're now listening to the Adiel Gorel Show. Each episode, I'll bring you the latest news from my discussions with top health and wellness experts so that you can bring yourself into better health. Today, on the Adiel Gorel Show.
So what happens is you have four chambers of the heart. Okay, so you got the top chambers, the bottom chambers of the heart. So the top chambers are called the atrias, and you could Google this on anything. You can be able to see the anatomy of a heart. So the top chambers are smaller, and we improve that heart function, and that's where we start to see the benefits of external counterpulsation.
Let's talk about growing new arteries, or as you call it so nicely, Genesis.
Angiogenesis, yeah.
Angiogenesis. So we have now used the sleeve to pressure and send more blood to the heart. Mm-hmm. So now the heart, when it contracts again, has more blood to play with, so to speak.
Yeah.
So I assume the pressure is going to be a bit higher. How is that going to create, angiogenesis?
So I want to go back to explaining ECP. So you have these cuffs like blood pressure cuffs. Everyone's had a blood pressure before. So imagine a cuff going around your calves, your thighs, and your buttocks, as I explained earlier. And they sequentially inflate to push blood back up to the heart. When we get this massive amount of blood flow, it comes right back to the valve where the ventricle is ready to push out the blood to the whole body. So there are some contraindications with this. If we see a poor aortic valve, which is the valve from the aorta, we won't do this treatment. And so we make sure that everyone gets an echo, or we test for that aspect of it to make sure it's safe for you to be able to do the treatment. Now, once that valve is compromised, so imagine you have this valve that is ready to open to push out blood out to the whole body. We have a whole bunch of blood that's been retrograded, backflow blood, ready to push out then a greater volume of blood to the whole body. The first arteries that the heart pushes out to is the same thing that you should be doing in an airplane. It puts its own face mask on first, so it feeds itself first. So the heart feeds itself first, and then everybody else. And so when we feed the heart itself first, we're pushing that volume of blood, and we're increasing. So the sheer stress of all that is increasing blood flow and healing to the artery wall. So blood flow is healing to the artery wall. Just take any injury that you've had, let's say an ankle sprain or a knee sprain or something like that. It takes a couple days or weeks to get over that. Well, it's the blood flow that circulates around that area. When we ice and heat it, that blood flow starts to improve. Lower inflammation, improve blood flow. Lower inflammation, improve blood flow. And now that increased blood flow is healing so we get a whole bunch of side benefits that happen when we do external counterpulsation therapy as well.
Healing, yes. But talk about the formation of new.
So the formation, let's take a highway system. Imagine it's 10 lanes wide. Okay, so we'll keep it simple for our audience. One lane closes up every week, and that's your route to the office, right? That's your route to the work. And by the time it gets to 6, 7, 8 lanes closed, you're like, you know what? This is getting too congested. I need to start to find side roads. I need to start going around and finding a different route to work, because this is just not working for me. So an artery that blocks over time is actually a good thing, because your body naturally tries and finds those natural highways automatically. External counterpulsation is just going to exacerbate that natural process that your body's already doing. So your body's already trying to do that. But what external counterpulsation does on top of that is increase a massive amount of blood flow. So if you have a 50% blockage, 5 lanes are closed, 5 lanes are open. Now it's going to allow those 5 lanes to flow with a lot more ease by strengthening the artery and allowing the artery to function more like a muscle at that junction. And so that's why it becomes important to grow new arteries. So angiogenesis is 2 things: pushing and forcing those other side roads to go around a blockage, but it's also another thing. it's healing the construction process of the artery so that the artery can function more like a muscle. And what happens is, again, it's that migration of smooth muscle to strengthen the artery. So again, it's strengthening the skin over that pimple. So then the artery functions more like a muscle at that junction without it popping, right? Because popping is a plaque rupture. Remember, 90% of heart attacks occur that way. In fact, many heart attacks happen where people don't even know about it. 20% of heart attacks happen that way. And so when we look at the artery side of things, that's kind of what's going on.
So, ECP therapy sounds intriguing, and naturally on a show like this, I'm going to segue my question over to the side a little bit and say, can it be used on healthy people to improve blood flow? In other words, a person, no problems with the heart at all. They just want the benefits of what ECP can bring. Does that make sense?
Yeah, absolutely. And gosh, we've had a lot of athletes use the ECP therapy bed. Once they start using it and they get some benefits. So what I think happens there is we see a better delayed onset muscle soreness. We push that out a little bit more. So after a workout, if someone goes on the bed, we're now facilitating the repairing of the muscles so that they can push themselves stronger the next day. And so when you ask me, is this for somebody that is healthy? I question most people if they are healthy. That would be number one. Number two, everyone, like the process of plaque building up inside the lining of the artery wall can happen to anybody. Like it can happen to someone who is fit, to someone who is unfit, to whatever the situation. So we see a lot more people, and I don't want to get into that side of things, but we know that COVID is a big deal. And there was a study that was done on COVID to use it for patients that ECP therapy was using on COVID to help heal, because we know that COVID has a spike protein that damages the lining of the skin. Remember, cholesterol is not one of those things that damage it, right? But hundreds of things that can damage it. COVID is one of them. And so that's why vaccines become very important to prevent COVID. But what we found out just in November there is that the vaccines also create a spike protein that damage the endothelium. So it becomes important to understand where the health is of your endothelium, number one. Number two, I'm not telling people to not get vaccinated. I'm not telling people to get COVID. Obviously, those are two important things that can damage the artery wall. But if you want to prevent COVID, get vaccinated. It does help. But you are taking the vaccine, understand that now it becomes more important now than ever to heal the artery wall. And that's where it comes down to the fruits and the vegetables and exercise and all those good things that you can do to heal, getting a good amount of sleep to heal the endothelium.
So when you said that athletes come to the clinic to use ECP, what are they looking for?
I think they're looking for recovery, and that's where I would consider using it. So I haven't seen too much data. In all honesty, I don't deal with too many athletes. It happens very minimal. I know there's a bunch of centers in the US that use it on athletes, and they probably would comment on the benefits a bit more. But how I can comment on it, I think it would help most people. I don't think you need as many treatments per se, but I think the benefits will help a lot of people, especially because we're increasing a massive amount of blood flow to the heart. And when you push that blood flow out, it helps the brain, it helps the eyes, it helps skin, it helps your teeth, everywhere. Remember, 100,000 miles of blood vessels that you have, it goes around the world almost 3 times. It helps everywhere where blood flow goes. And so kidney function, erectile dysfunction, we see better that. We see better circulation. We see so many different things. And I'm going to go back on a step. Erectile dysfunction, especially if it's vascular related, because erectile dysfunction happens to be a big marker for cardiovascular disease. It's one of our biggest markers for cardiovascular disease because it's a blood flow concern. And so those are the things that we're kind of looking at to help improve for people who are unhealthy or healthy. And in our clinic, we see people who just want to be proactive to people who already have artery disease, and everyone can benefit from ECP therapy. It's just a matter of, trying to come up with the right formula to help them out with that. Because am I going to recommend someone do thousands of dollars of treatments on ECP therapy if there's no real concerns? We do very thorough testing, and once we find out that some people have endothelial concerns or endothelial damage or heart concerns or high blood pressure or diabetes, absolutely, that's where it will benefit the most for those people.
Well, it sounds to me that many machines, therapies, and businesses would want to get the biggest market that they can sell to. That's just a natural thing. That's in business. Mm-hmm. The manufacturer of those sleeves surely wants to do it. If I'm not mistaken, Pfizer actually made enormous amounts from Viagra. So it sounds to me like that would be a bigger market mm-hmm. than just the people, the subset of people with heart disease. Wouldn't it make financial sense to go that route and get many more,
At the end of the day, I'm a science guy. There's a lot more research on the fact of what it does for patients with heart disease and heart failure. I just haven't seen the data to help the patients as much on the other end of it. Not to say that it couldn't, because we do a lot of ECP therapy for people, but we know that they have a concern, right? There's artery function issues. There's a artery health concern. Their risk of a future heart attack or stroke is really elevated. So in that person, I feel more confident that I can show pre-post numbers as to where we're going to see benefits. For someone who is completely healthy, to go and do that treatment, I have no markers to, at least in my toolbox, to show what it's going to be able to do.
Of course, I understand.
So that's where I come from that side of it. Not to say that it couldn't benefit. Gosh, I don't have artery disease. I go on the bed. I go on the treatment. I also had COVID too. So I had COVID last month or 2 months ago now, and I also had COVID. And so I've been using it as a treatment side to help my endothelium, because I know that COVID damages the endothelium. And the last thing I want is I've got big goals to try and achieve here. And the last thing I want is something to hinder me in terms of brain fog, or, I'm slowing down a bit, or whatever might be the situation on that.
Okay, so let's go back to your statement that you don't have any artery, disease yet. Never mind, the COVID. You jump on the machine. Mm-hmm. Why? Why do you jump on it?
So I know it makes me feel better. Right. And so I just don't have the markers, and I haven't done the markers on myself. I have been patient. I've done all the testing, but I don't do the exact pre-post numbers on that. I go and, let's say I maintain the machines. I'll jump on the bed for an hour, and I'll do that a couple times a month. I know it makes me feel better when I do that. I have more energy. I just feel more alert. I feel better. And again, when we're increasing a massive amount of blood flow to the heart, we're going to see benefits. For me to recommend this to everybody, the research is just not there. That's all I want to be able to be.
I understand. Absolutely. I'm not holding you to anything. Now, when you were describing the sleeves on the ankle, on the thighs, on the buttocks, I couldn't help but think about all those people that I see on planes and I talk to. They wear pressurized socks. They have varicose veins, usually in the lower part of the legs, because the blood flow and the vein, it sounds like this would be an amazing therapy for that, or am I wrong?
So I don't have much data on the varicose veins. I know it's not a contraindication to doing the treatment, so that's not something I can do. It could go one of two ways. I haven't seen the latter though. I've heard of the latter. I speak a lot at conferences, and I get invited to a lot of medical conferences to speak about ECP therapy. And there are some practitioners that use ECP therapy, and they see benefits with varicose veins. I've seen benefits to varicose veins, but I've also had some case studies where it can be painful to do it, because you're increasing, because varicose veins are damage to the venous system, right? And so when we're retrograding blood flow back up to the heart, because we're doing two things. You have we'll call it a red and a blue system to keep it simple. So you have an oxygenated part where, remember, that ventricle is pushing the oxygenated blood, and then you have all the blood that gets used out to everywhere in the body. Then you have the venous return. So it returns back to the heart, and kind of happens from like a wetlands to a roaring river back to the heart, if that makes sense. believe it or not, the speed of the blood, the artery pushing the blood out is the same speed the veins bring it back to the heart. And it works. The heart is not really a pump, and I don't want to get into that side of things on that end of it. But the point I'm trying to make with this is that the venous return that happens back to the heart happens very quickly. And so we're increasing now more blood going through the cardiac cycle as well, because the blood goes down to the bottom chamber, it pushes out to the lungs, fresh oxygen, it comes back to the lungs. Now we're increasing more blood flow through that cardiac cycle. And so that's kind of where that happens. So with varicose veins, I haven't seen any damage to that side of things, but I've seen more benefits than I have of anything, or neutral.
Benefits that you've seen. Again, this is not
benefits. Yeah, so benefits are more, they can disappear or get lessened is what I hear, or what I've seen, sorry. But there is the opposite too, where it could be damaging, and you'll notice that with pain more than anything.
So that's very good to know. Again, I'm striving on this show to make it accessible to every viewer, not just a subset of viewers who may have a heart issue. That's why I'm going that route. So you said you jump on it a couple of times a month for about an hour. Normally, if somebody lays on this and uses it for 1 hour, there's an effect. But obviously, you said in order for the effect to last, you need to do it over a prolonged period of time. How long?
So our treatment course is either 20, 35, or 50 treatments. And so where I would recommend 50 treatments is for someone who is dealing with a severe blockage and is diabetic and got heart failure issues or something like that. Most people fall in that 35 that have artery disease or high risk. And then I'd say that there's a subset of people, very minimal, that would fall into the 20. But that we, again, see, we're a heart clinic, so we see people who are at risk of cardiovascular disease or have cardiovascular disease. And so what we're trying to focus on is that the compound effect of doing the treatments is where you start to see the benefits. And the benefits can last, I've seen them last longer, like 8+ years, but some people it doesn't last as long, maybe a couple, 3 years even. So what I like to have people do is come and do some maintenance sessions once in a while just to keep it going, because the body has a memory system, and when it sees it and feels it, it likes to be able to increase that blood flow to help improve that from that end of it.
So jumping back to what we talked about before, you talked about the inflammation, the damage, and so genetic factor, do they play a role? Your father had a heart attack very, very young.
Yeah.
I mean, are genetics relevant, or it can be mitigated?
So I think genetics are important, but you don't always have to follow your genetic risk. And so I'm 46 now. I passed 38, so I did not have a heart attack for the last 8 years. And so who's to say that I couldn't in the future? But the point is I'm also doing all our testing in our clinic to make sure I don't. I'm a patient all the time here. And so I'm a guinea pig all around the time in this place. But think about you have all these genetic markers or DNA in your body. And if you have a genetic predisposition to having cardiovascular disease, something has to turn it on. For me, let's say if I started eating really poorly, right? That could turn on that genetic SNP and cause a problem. If I started smoking, that would turn on that genetic SNP and start to cause that inflammatory cascade. On the opposite end of it, that's why we hear people that can live till they're 95 years old and smoke all their life and never have a problem. And it's because they don't have the genetic SNP to turn on when smoking, smoking doesn't turn on that genetic SNP for them. So think about these as an electrical panel. That's the best way I can say it. Think of it as an electrical panel. And for everything that you do that might be poor, for example, if you start to have caffeine, it might affect you differently than me because you have the genetic SNP for it. You get that electrical panel turned on. So imagine looking at a whole electrical panel, and that's the best way I can say it. So you have all these genes and everyone's electrical panel is different. So you get to have caffeine, I don't, as an example. I get to have chocolate, you don't. I have to have a lot more abundance of vegetables, you may not have to. you might thrive on fat better. And this is where it comes down to diet. I don't ever think a diet is for one person. I don't ever recommend, you know what, you should be definitely, we should be everybody should be taking the keto diet or the paleo diet or whatever it is. I already mentioned my thoughts on diet. It's the foundation of it. Stay away from sugar, stay away from processed foods, and stick to things that don't advertise to you. The vegetables and fruits never advertise to you. I don't ever say, oh, lower your blood pressure over here, or, you know, whatever it is, you know, like there's a lot of good stuff that foods can do for you, and we got to take advantage of that.
So, you know, with all the work that's done on heart disease, I think it's still the number one cause of death worldwide. Where do you see it going? I mean, even the, you know, we've looked at the ECP, many other things are coming, and yet still, is it because so many hundreds of millions of people worldwide trigger those, you know, just like you said, how can we make heart disease not be the number one?
I still think it's going to be the number one, or definitely one of the leaders for sure, for morbidity and mortality, morbidity, hospitalization. And so when we look at that, I just think we're in an environment where we want instant gratification. We want to tell Alexa, order me some toilet paper and it's sitting on my door in minutes, or whatever, you know, like this is the world we live in. And I think instant gratification is the reason, and just psychologically, and I wrote about it in my book, you know, mindset becomes very important. Instant gratification is one of the biggest reasons why I think we have artery disease, right? And I don't know if that's going away as a population. You know, I love the idea of keeping, you know, stress under control. And I love mindfulness and relaxation and meditation, and proven, like, who from a heart side of things, you know, you tell someone from a heart side of things like 15 years ago, even, you know, meditate and that'll help with your heart disease. Like, what the hell are you talking about? I don't believe you, right? And so it's proven, like, if we can calm the mind and help out with that side of things, I just don't think most people are not at that state. And so I think we're going to continue to see it. I think a lot of marketing pushes us. I think also my views on COVID is not going away. I don't think we're ever going to have this go away. There's going to be many other viruses that are going to hurt the endothelium. You know, there's going to be pharmaceuticals that can damage the endothelium. It's not going away. And so I still think it becomes important to heal the artery wall with what I talk about in my book, Beating Heart Disease. And so, yeah, obviously exercise, nutrition, stress management. You know, I talk about relationships, you know, having strong relationships now more than ever. Gosh, like you see the relationships that you have are super important. Like, I think people realize, you know, the environment that we're in, that it's super important to have strong relationships. Your heart's a love muscle. You know, it has to be giving love and receiving love, and show that it's loved. And so, and then mindset was my last pillar. So I talk about 5 pillars, 5 powerful pillars to prevent and reverse heart disease. That's what I ended up talking about in the book. And so I don't see it going away, but if people want to reverse it, I think they got to be conscious of understanding what they're doing, because it's easy to pick up a chocolate bar at this because it's sitting right on the shelf. And, you know, you go to the grocery stores, it's marketing to you at the, you know, who's paying the best dollar to market to you. It's all about that, right? It's who's going to pay the big dollars to market. And unfortunately, it's the stuff that gives instant gratification.
So it's been said that a body in motion stays in motion. So the role that exercise plays in all of this that we've been talking about, the circulation in our body, what kind of exercise, how do you look at that?
I think exercise is one of the most important things that we can do. People always ask me, well, what is the best exercise that you can do? I think just doing anything, if you're not doing anything, is always important. Just parking your car further, walking around the mall, just getting active, going for walks, having a dog, taking it out for a walk. Those are all important things. If you want me to ask me the best exercise to help, you know, I start to get into high intensity stuff or strength training. I think that's the best thing that you can do for the artery wall. And so that's where I lean more towards that. And I start to harp on that more for patients that I see in our clinic that are especially increased risk of a heart attack or stroke, or have it, or have artery disease. And so that's really where the premise of what we're trying to improve when we do that.
Well, it kind of makes sense because if you talk about high intensity, you talk about greater blood flow. We talked about the ECP. It creates greater blood flow. Of course, it seems to be like it would be more beneficial.
Yeah, absolutely. So, gosh, like to reverse heart disease, I use a combination of everything, right? And if I had heart disease, I'd want to do everything I can to make sure I reverse it. And that's what we do at our clinic, right from food to exercise to ECP therapy, all those are very, very important to help reverse a disease process, and it can be done.
Diamond, what if somebody is viewing this podcast and says, gee, I want to work with this guy, I really do, but I live in New York, in California, he's in Canada.
Yeah.
So can you do a lot of this stuff by Zoom? Of course, the therapy itself, the ECP, they need to find a local place, but I assume that they can find one.
Yeah, and I consult with people all over the world. There's a handful of people I do in the US that help. And gosh, even in Singapore, Bangkok, I think is another person I see. And so they just want my time to understand what it is that they can do to help reverse the disease process. And I just connect with them once a month, and it could be over Zoom, and I tell them what testing that they can get done in their area, what they can do. And sometimes they even fly to our clinic just to get the baseline and then go back home and go about doing what they need to do to help with their heart health. And I just guide them on that side of things. So I'm just, I should say I'm just, but I guess I'm their right hand kind of going forward, if that makes sense, to helping and prevent and reverse heart disease.
That sounds great. So if somebody does want to make use of your great services, what do they have to do?
So our website is heartfit.ca. So that's the best way to get a hold of it. It's going to be changing a little bit. Here we have HeartFit University that we have as well. And so there's a lot more education portals where I give a lot more of my education. I could talk all day long. Like I think we could probably make this podcast a whole 20 hours if we wanted to, because I could have dive deep on all those questions that you asked me. But I didn't want to do that for time's sake. But the idea is that I just like to dive deep on that side of things. It's just I kept it very superficial today so people can understand that. But heartfit.ca is the website where people can go and book, that treatment or assessment or whatever they want to get done with it, even if it's the conversation with us to help understand where their risk is.
Heartfit.ca.
Yeah, correct.
Well, Diamond, I want to thank you so much for your time and all the knowledge and insight that you gave us. It's nice to know that you're a resource that we can use. It's also good. Yeah. So thank you so much. It's been great to find out. It's been great to find out about all of this.
Yeah, thank you very much, and appreciate you interviewing us. And I look forward to helping people, really prevent and reverse heart disease. That's our big focus.
Thanks a lot.
Take care.
Bye. Thank you for joining me today for the second part of our amazing interview. If you didn't catch part 1, don't miss out. The link is in the description below for you. And be sure to click the subscribe button for more videos.